Hello, my name is Weston Clay and I'm a psychotherapist at My Therapy NYC. In this video blog today, I'm going to be talking about the link between trauma and addiction. Sometimes addiction can be hard to understand, whether you're struggling with it yourself or if someone you know is struggling with addiction. You might wonder, why can't they just quit? Why are they continuing to engage in this behavior that they know is harmful to themselves? And the answer to this often lies in trauma. So what exactly is trauma? I think of trauma as any experience that we have that overwhelms our ability to cope. This could be what we call a big T trauma, which is something like an accident or a single incident assault. Or it could be a series of little t traumas, or what's sometimes called complex trauma. And this is a pattern of abuse or neglect in a relationship with a parent, or you could experience something like this with a partner. And the key either way is that we feel unable to cope with the experience, and often we feel very alone. Trauma tends to lead us to feel very anxious, to feel ashamed, and again, to feel this unbearable feeling of aloneness. And these emotions are very hard to kick. And for a lot of people, they can be pretty prevalent and something that they experience kind of all the time. And this is where addiction comes in. When you have post-traumatic stress, you essentially have a nervous system that rarely, if ever, feels settled. So you know how it's pretty normal for people to want to have a drink at the end of the day to unwind, or smoke some weed or something like that, just to kind of unwind from the end of a stressful day. Well, the relationship between trauma and addiction is basically an extreme version of this. If you had a stressful day, maybe your nerves are kicked up a little bit, you're feeling a little anxious, you're feeling a little wound up, and that drink or that weed can help you to feel settled. And so a person who has a nervous system that pretty much never feels settled and who never really feels safe may feel a lot of relief when they use drugs or alcohol. And though the relief is temporary, it may feel kind of miraculous while it lasts because it's something that they don't experience in a day-to-day way. And so if they continue this cycle, right, continue to seek relief through the substance, which, it makes sense that they would if it feels good, they may come to associate the substance with that lack of feeling of anxiety or that lack of feeling of terror that they otherwise would be feeling at that time. And if they continue this cycle and that association strengthens, it may get harder and harder to resist using that substance, even if they kind of know it's harmful or know that they're going to feel worse later. And if this cycle repeats itself enough, that person has developed an addiction. What is important to understand if you're struggling with addiction or if someone you know is struggling with addiction is that it's an attempt to feel normal. It's an attempt to regulate anxiety and regulate feelings that feel unbearable. And the addiction did not develop just because that person is weak or because that person is reckless. It developed because the substance that they found provided some much needed relief. Unfortunately, addiction is also harmful and can negatively impact a person's physical health, a person's mental health, their ability to function well in their life, and the quality of their relationships. So it leads to a whole host of other problems. But quitting doesn't really feel like an option, right? Because it means going back to those intolerable feelings that were there in the first place that may be related to trauma. So what do you do, right? You're kind of stuck in this place where either you're using a substance and that's causing you harm, or you're feeling these emotions that are pretty unbearable. Well, the best thing to do is to try to find some help. So if you can find a mental health clinician or a team of mental health clinicians who specialize in addiction and trauma, they can help you to figure out a course of treatment that will work best for you. Sometimes this is like an inpatient situation, but sometimes it's just working with a therapist. It depends on the severity of your situation. For some people, the course of treatment is focusing on sobriety and developing the coping skills necessary to be able to cope with the feelings that underlie the addiction, and then addressing the trauma. But in some cases, the person may need to kind of scale back the substance abuse to a point where it's more manageable, and then kind of address the trauma at that point. And this would be called a harm reduction approach, where maybe you're not getting fully sober, but you're scaling back your substance use to the point where it's a little more sustainable, and then you're addressing the trauma. Either way, the goal is to find a way to either eliminate or greatly reduce the harmful impact of the substance use, and to address the underlying feelings that drove this person to the substances in the first place. Both of these things are really important to address, because if you miss one of them, then the other one's likely to come back. So if you get sober, but you're dealing with a lot of post-traumatic stress, there's a good chance that you could relapse, because all of those feelings are what drove you to the substance in the first place. So if you or someone you know is struggling with substance abuse, it is probably going to be helpful to view the situation with compassion and understanding that this is a way to cope with something that feels unbearable. And seeking treatment that can address both the addiction and the trauma is often the key to getting sober and staying sober, or for some people, just finding a healthier balance that may not involve full sobriety. So thank you so much for watching. I hope this has been helpful. And we have lots of great resources on our website, including more video blogs like this one, written blogs, webinars. So you can check out our website, mytherapynyc.com.